Good afternoon. Good afternoon. You're welcome to our pharmaceutical calculations BD 253 lectures. We are still on the topic dosage calculations. In our last class, we concluded with adult dosing. Now we'll look into pediatric dosing. According to BNF, we have these three categories or four categories. We have the one we have neonates, we have infants, we have I call this child. We have younger child and what? Older. Neonates start from the day of what? Birth to what? 1 month. Infant is from say 1 month to 1 year. Then we have this younger child from 1 to what? 6 what? Years. Then we have from 6 to what? 12 years. So anything above 12 years or before 18 is what? No, is what? No, what is the right term? Thank you, adolescent. Then from 18 up, adult, okay? So our focus is here. So if you give birth to a baby today, the baby is a neonate. Am I communicating? Up to 1 month. 1 month is infants. Then from 1 to 12 years, the baby is a child. But they are not exactly the same. We have the one from 1 to 6 years. 1 to what? 6 to what? 12 what? Years. Up what you go. Now, all right, thank you. So, when you are administering a drug to a child, it's not just don't just use the age. Also consider the body weight. Am I completing? Also consider the body weight. Giving a drug to a medicine to administering a medicine to an adult is quite easy, because once you know that the person is an adult, this is what and what you should give to the person. Am I completing? But this one, you must look into the body. That's why as they come in, the first thing is to check their the body weight, then know what and what to do give, and what to give and what not to give. Now, I don't want us to waste time here, okay? We are going straight. As we see 1 or 2 calculations, then I will explain what and what you need to know. Then I'll conclude. When I'm done, I'll conclude with 3 important formulas. Because there are some questions that you will see. There's also whereby you use. Don't worry, when we get there, I will explain. Let me not waste time. You all have all these things, right? So I don't want us to waste time on the board again trying to copy and on the board. You have all this in your phone, right? So go to example 8.1. Go to example 8.1. There's a question there. The question says, go to example 8.1. Go to example 8.1. Can you see it? I believe you've gone through all these things, right? That's why I sent them to you. I learned that your exam will soon start, so there's no time, no need, no time to waste again. We have a lot to cover. So please study ahead. Study what? Ahead. We're not going to be, cooling down to be explaining things, trying to bring it down to you secondary school level as we were doing before. Now we are going to do what? Lecture. So you can cover up. But that doesn't mean that if you have any question, you don't ask, okay? If you have a question, you can always do what? Ask. Maybe that question will help us to explain it once and for all, but not sitting down and be counting it one by one the way we were doing before. There's no time for that one again. The question says, let's look at this question. From there, I will explain a lot of things I need to explain. The question says, the recommended dose of fluconazole for mucosal candidiasis in children is 3 mg per kilogram daily. Calculate the dose of fluconazole for a child aged 3 years and a child aged 11 years. Suggest a suitable formulation for both. Now, the question says that the dose, look at the first thing you should point out, they pointed out here, the dose. The dose for a child is what? 3 milligram per kilogram daily. This is the dose. Do you know what this thing means? Do you know what it means? 3 milligram per kilogram. Do you know what it means? I will explain. Now, that is the dose. There are 2 children here. We have the one aged 3 years. The one aged what? 3 years. And the one aged what? 11 what? Yes. We are now asked to calculate the dose of the what? Fluconazole for each of them. Now, before we go to that example 8.1, that go up a bit, you see a table. Can you see a table? Now that table, according to BNF, this now has been measured, all things being equal. This table shows the age of a child, the age, not just children, from child to both children and what? Adult. The age, ideal body weight, and the what? The height. Under normal circumstances, there is an ideal body weight. Somebody of an adult should have. Am I communicating? There's an ideal body weight and an adult should do what? I learned you're not feeling fine. You okay now, right? There's the body weight, there's an ideal body weight. An adult should do what? Have. We call it a physiologic man. You read physiology, right? You are in physiology now. You've not done physiology here? And done physiology. Okay. Now, a physiologic man is expected to have a weight of around 70 kg. 70 kg. Am I completing? That is a physiologic man, but it doesn't always follow that. Depending on the individual now. But that's an ideal weight. But some rare situation may make the person not get up to that weight, or it will be more than that weight. The person may be obese. Depending. But this is an ideal. The same way now. On this table, what I are seeing there is an ideal body weight for people of these different ages and the ideal height they should have. So a child of a full-term unit. You know what a full-term unit is? What's a full-term unit? No, a full-term unit is you should know. Who is a full-term unit? Okay, no problem. Somebody 9 months. 9 months is a full-term. Hope you know. Full-term is 9 months, right? Good. Somebody that was given birth to at least at 9 months Am I communicating? It's a full term. Preterm is what? Somewhere that maybe 7th month. Two of us, we have preterm, premature. We call it premature birth, right? But a full term, 9 months at least, that person should have a body weight of around 3.5 kilogram, and the height should be around 851 cm. It's on the table. Now, for a child of 1 year, it's expected that the body weight should be around what? 9 kilogram. Am I communicating? Now, based on what this table is saying, we cannot use the things in this table to answer the what? This question. Now, for the child of 3 years, it's expected that the body weight should be what? Look at the table. 14 kg. A child of 11 years, it's expected that the body weight should be what? 11 years. It's not there. Now, between 12, 10 and what? 12. What is the age? What is the body weight of a 10-year-old? 30 what? What of 12-year-old? 39. Add the two of them is what? 70 what? Find the average is what? Find the average is what? Find the average. What's the average? Answer me now. You say what? Is that the average?
Yes.
Huh?
Yes.
Okay. I'm coming. .5 what? Point what? 5. Depending, you can leave it at what? At 5. It's okay. Okay? Are we together? Are we together? You can leave it at what? 35. Don't too much jump. I'm not going to don't too much to what? Jump. You can leave it at that. It's okay. It's not bad. You can also leave it at 6. But I want to use 35 because here there is what? 35. Now, but just know that it should fall between what? It should fall between what? 32 and what? 39. That's the what? The basic thing you should know. It should fall between what? 32 and what? Who has seen who has checked his or her weight here? Who has checked his or her weight here? Okay, assignment. If you have access to this hospital, try to look at the scale, the calibration there, and check whether you can see 0.5 there. Whether you can actually have 35.5. Okay? You can find out whether the lowest calibration there, check whether it's 1 kilogram or 0.5. You know how to check lowest calibration now, right? Right? Good. That is the value of 1 division. Check if it is what? 0.5 kilogram or what? 1 kilogram. Anyhow, just know that if you use 35 kilograms, see what you have here. If you use 35 kilograms now for 11-year-old, see what you have here. 35 what? Kilogram. Look up. The dose for this child, the one of 30 years is this. This 3 milligram per kilogram means this is actually what? 3 milligram of the drug per kilogram of the body what? Weight. Does it make sense? This means 3 milligram of the drug per kilogram of the child's what? Body weight. That means for each kilogram of the body weight, you require 3 milligram of the what? Drug. So if for every 1 kilogram of the body weight requires what? 3 milligram of the drug. But the child weight is what? 14 kilogram. Therefore, 14 kilogram child will require what? X. X is now what? 1 kilo. So X is now what? 14 kilogram times what? 3 milligram over what? 1 kilogram. Kilogram cancel kilogram. 14 times 3 milligram is what? 42 what? Milligram. So that means this the 3-year-old child will require 42 milligrams of the drug per what? Daily. That's the meaning. This has to do calculation using the what? The body what? The body weight. Now here, for the 11-year-old child, it's still the same dose rate, the same 3 milligram per what? Kilogram. But here, of course, 1 kilogram require what? 3 milligram. But the body weight here is what? 35 kilogram. Therefore, 35 what? Kilogram will require what? X. X is now equal to what? 35 kilogram times what? 3 milligram over what? 1 kg. Kilogram will cancel kilogram. 35 times 3 milligram is what? 105 what? Sorry, thank you. Milligram. 105 what? Milligram. Okay. 105 what? Milligram. That's the what? The dose. The child, the 11-year-old child will do what? Require. Oh, he has gone. This thing has locked again. If you come, can you open it? If you come, let me open it. Come. What's the name again? Chibike, right? Chibike. Okay, so this, the 11-year-old child will require 105 milligrams of the drug, while the 3-year-old child will require what? 42 milligrams of the drug per day. But there's a question there. There's a question they ask there. This is the dose, right? They ask a question there that we should suggest. Someone should read it. We should suggest what? That we should suggest what? For both. Now, by formulation they mean how many, whether they require whether it should be in suspension form or should be in what? Capsule what? Form. But without being told, a child of 3 years and a child of 11 years, which one of them do you think will require the one in suspension and the one in capsule form? Or the one in, which one? 3 years suspension, right? Why the other one is what? Capsule, right? Good. Now, the second question is this. How is fluconazole presented in the market, at least Nigerian markets? How does it come? What milligram capsule do we have in the market? And what is the strength of the suspension we have in the market? Fluconazole. Any idea? In Nigerian market, any idea? Any idea? No idea. Okay.
I don't know what you mentioned yet. Capsule. They used to have 50, 150, 200.
Good. Capsules, we have 50 milligram capsule. We have 150 milligram what? Capsule. We also have 200 milligram what? Capsule in Nigerian market. That is, I'm sure of that one. Fluconazole, I've seen the suspension comes in 50 milligram per 5 ml. Suspension fluconazole I've seen here. Suspension fluconazole I've seen here comes in what? 50 milligram per what? 5 ml. That means each 5 ml contains what? 50 milligram. While the capsule I've seen here is in what? 50 milligram, 150 milligram, 200 what? Milligrams. Now, if that is the case, for the child that require 42 milligram, how many capsules do you think you should give to the child? Sorry, how many capsules do you think you should give to the child? 50 milligram, right? For a child of 3 years, but can he swallow it? You can't swallow it, right? So you have to move to what? Suspension. So suspension here is 5 ml. 5 ml is what? 50 what? 50 what? Milligram. So that means in the bottle of a particular volume of it, from here, what it means that each 5 ml you take from this bottle, it will contain what? 50 what? Milligram of fluconazole. So how many ml do you tell the mother to be given to the child for a dose? 10. How did you get 10? Tell us how you got 10. Miracle. You're not sure? So how do you have a 10? No, you're missing something. I thought we did this in normal adult dose. Now when we did liquid formulations, if the strength of the what you want to use is 50 milligram of fluconazole per 5 ml, and you want to give a child 50 milligram of fluconazole, how many ml will you give to the child? This thing still boils down to distinguishing between strength and what? Dose. The dose you want to give is what? Here, normal is for 2 milligram, but because we cannot get it this easily, we give what? 50 milligram. Now, this is the dose you want to give it to a child. We have agreed here that you cannot give a child 50 milligram capsule because of what? You cannot swallow it. You move down to what? Suspension. I'm not asking. The suspension, the strength of the suspension is 50 milligram fluconazole per 5 ml, and you want to give the child 50 milligram. How many ml of the suspension will you give the child to deliver the 50 milligram? 5 ml, thank you. 5 ml now, since the strength is 50 milligram per what? 5 ml. Once you give the child 5 ml, you are giving what? 50 milligram. So a dose of the drug will now be what? 5 ml. True of us? 5 ml. So 5 ml daily. Look at it. Remember this thing we got it from here. I hope you know. So the child dose now is just get the fluconazole, shake it well, give 5 ml of it daily. The child would have taken what? 50 milligram per day. Simple. Remember they ask a question that we should suggest. So we are suggesting now that you should give suspension fluconazole 50 milligram per 5 ml. And if you want to deliver the dose, you give 5 ml. Once you give 5 ml, you're giving the child 50 milligram. Does it make sense? Does it make sense? Good. Now, another point I want to make here is that we now move to what? The 11-year-old what? Child. Let's move to the what? 11-year-old what? Child. See, if you can swallow capsule or tablets, and I'm given drugs in suspension form or liquid form and the tablet or capsule form, and I can swallow it, I'll go for what? The capsule. Do you know why? At least it's cost effective, it's cheaper, and they'll still do the same thing, work. It's the same what drug. A bottle of this, if you want to treat, if you compare these two things, this fluconazole and this fluconazole in suspension for suspension form and liquid form for a child that can swallow tablets or capsule, and if you compare the two of them, the capsule will be less cost effective because it will be less what you spend less treating with that capsule than treating with what? Suspension. Are you aware? Are you aware? It's more expensive. Go to the market, go and buy syrup, go and use syrup paracetamol to treat malaria, even for you as an adult, for 3 days. And go and buy tablet sachet. That sachet you bought 100 naira can treat you malaria for what? 2 days. But suspension or syrup, 2 bottles will not be enough for you. True of us? So that means I don't know how much they sell one bottle now. How much? So that means, and if you start taking adult dose, one day one bottle finish, two of us. Then check 3 bottles, 750. One card of paracetamol is what? 150. Have you seen what I'm talking about? It's more cost effective. Now that's why I start with what? The capsule. But if the baby cannot swallow it, you go down to the what? Suspension. Now let's suggest for this 11-year-old what? Child. The dose is what? 105 milligram. Now let's start with capsule. This is 105. Do you think you should give this child, this child, which of them do you think you can give to this child? Is it 50 milligram too? Or 150 milligram? Or 200 milligram? Which one? 50 milligram. So that means, can he swallow it? 11-year-old? He can swallow it, right? So that if 11-year-old can swallow it, simply give what? A dose will give what? 2 capsules of the what? 50 milligram. You have achieved your purpose. Because since the baby can swallow it, if you go to this suspension, you spend money and run away. You will spend money. Is it clear? So I will suggest what? 2 capsules of 50 milligram what? Per dose. Then this one is suspension at 50 milligram per what? 5 ml. We will do the job. Okay, these things are practical what? Scenario. Real life what? Scenario. Okay. With this thing now, you can solve as many questions as possible on this without even wasting time. I don't want us to waste time again. Trying to, okay. Yes. Milligram.
As I said, if they don't want to, like, the baby cannot solve the gas, but they will do the suspension. So, but we should say that, like, it will not be 42 milligram per 5 ml instead of 43 milligram.
No. I said that if you start if you do the calculation, go now, you may be getting 4 point something mil, which you may not easily measure. Am I getting? So simply give what? 5 mil. 5 mil will deliver what? 50 milligram. It not cause any issue. Okay? Simply give what? 5 mil to deliver 50 milligram. It will not cause any issue. Because the difference is not what? Much. Okay? Let's solve one more example. Let's look at example 8.3. Let's look at example 8.3. I want us to conclude everything concerning this thing, if possible, today. This dosage, this thing, if possible, today. After this, there's a formula I'll give us. Then, I'll tell you what to do about nomogram. Then, we take it off from there. Okay. Look at this question. Example 8.3. It says the drug amikacin has a dose has a dose of 15 milligram per kilogram daily. The drug amikacin has a dose of 15 milligram per kilogram daily in 2 divided doses. In 2 divided doses for children. Full stop. Calculate the dose for a 6-month-old child and the volume of pediatric injection to be what? Given. Calculate the dose for a 6-month-old child and the volume of pediatric injection to be what? Given. The drug amikacin has a dose of 15 milligram per kilogram daily in 2 divided doses for children. So now, the dose, remember, anytime, I keep saying this, anytime you are solving calculations in what? Dosing or dosage, please bear 2 things in mind. Try to identify 2 things. First is the dose. Second is the what? The strength. Once you can identify which is the dose and which of them is what strength, you have solved the question. Where people have issues is taking the dose to be what? The strength. That's where they have issue. Once you can identify these 2 things, you are good to go. It's all about identifying the dose and the what? The strength. Now, let's look at this question now. From this question, look at that example 8.3. Which one do you think is the dose? Which one do you think is the dose of the dose of amikacin for amikacin? Good, thank you. Dose is what? 15 what? Milligram per kilogram per what? Per day or daily, okay? Per day. Whether it's daily or daily, is that talking about the same thing. That is dose. 15 milligram per kilogram per day. That's the dose of the what? Amikacin. Now, the age of the child is what? 6 months. From that table, 6 months should be what kilogram?
7.6 kilogram.
From the table, confirmed. 6.6 what? Kilogram. Now, we want to calculate the dose for the child and the volume of the injection to be given. Now, let's calculate the dose that the child should be given. Okay, sir. Let's calculate the dose the child should be what? Given. Now, this is the dose, general dose for amikacin should be given to anybody. So if you are 70 kg weight, you do the what? Calculation. Whether you are 5 kg weight, you do the what? Calculation. That's the meaning. This thing will give different results for different people with different what? Body what? Weight. That's what one thing I want you to understand here. Now, this 6 months child has a body weight of what? 7.6 what? Kilogram. If the body weight of this child is 7.6 kilogram, what is the implication? The implication is that, this means that per 1 kilogram of the body weight will require what? 15 milligram of what? Amikacin. Then for the child is 7.6 what? Kilogram body weight. So therefore 7.6 kilogram will now be what? X. X is now equal to what? 7.6 kilogram times what? Times 50 milligram over what? 1 kg. So kg will cancel what? Kg. 7.6 times 15 milligram is what? So the child will require 114 milligram of what? Amikacin per day. So the dose of amikacin for the child in question is 114 milligram per day. How will you now know? We have calculated the dose for the child based on the body weight. How will you now know the how the volume of the amikacin to be injected to the child. How do you now know? You know by looking at the amikacin in the market, the strength. The strength will not come in here, right? They didn't give us the strength. It's assumed that you should know the strength of amikacin in the market. These are things you should know. That's why I encourage you people to buy MDEX, especially in Nigerian markets. Buy MDEX. If you cannot buy it, get the app. Look, you use it to study. Most of these drugs you'll be doing in pharmacology, try to find out the one in the market. Am I communicating? Good. How is it presented? What is the strength? So now, amikacin in the market also comes as what? It comes as 50 milligram per what? Per what? Male, sorry. Per what? Male. 50 milligram per what? Per male. What is the implication? It means that 1 ml of the injection contains what? 50 milligram of what? Amikacin. That's the meaning. So if 1 ml of the injection contains what? 50 milligram of what? Amikacin. How many ml we deliver what? 114 what? Milligram of what? Amikacin. X is now equal to what? 1 ml times what? 114 milligram over what? 50 milligram. Milligram will cancel milligram. Remember, we are calculating the volume that we will inject. 114 divided by 50 milligram is what? 2 point what? 2.28 what? So you will inject what? You will inject what? 2.28 ml of the what? Amikacin per day. Let me ask a very important question. Go back to the question. Read the question again. There's something I want to point out.
The drug amikacin has a dose of 15 milligrams per kilogram daily in 2 divided doses.
Thank you. In 2 divided what? Doses. The daily dose is this. This is the daily dose. Hope you know. 114 milligram. So in that daily, in that 2 divided dose, so a dose in that day should be how many milligram? No, let's start from the dose. Who said that? Thank you. They say in 2 divided what? Remember we have daily dose and divided dose. In 2 divided daily dose, in a day, divide this into 2. The first injection will be what? 57 milligram. Maybe after like 12 hours or so, the second injection will be what? 57 milligram. The same way you divide this number of ml, you will inject into 2. You have what? 1.14 ml. So what it means is that maybe in the morning they will inject the child 1.14 ml of what? Amikacin. And that 1.14 ml will deliver how many milligram? How many milligram? How many milligram will it deliver? 57 what? Milligram. 1.14 ml will deliver what? 57 milligram in the morning. Maybe after 12 hours again, you now inject under what? 1.14 ml, which will deliver how many milligram again? 57 milligram. So that means in a day, the total dose in a day is what? 114 milligram. And what volume would deliver it? 2.28 ml in a day. That's the meaning. Okay, please. Okay, let's keep moving. Remember, we were talking about the body weight, right? There's something else. There's another instance I want us to look at. You can also, there's also dosage calculation based on the what? Body surface area. Based on what? Body surface area. I think we'll stop there. I will now give you there's about 3 formulas we'll look up now. I want you to check it up yourself. Then, if there's still time, we can use it to solve question. If there's still time, we can read a nomogram. How to read a what? Nomogram. If there will be time for that. If not, then we'll continue next week. Now let's look at based on what? Body what? Surface what? Area. Now there's something I want to say. What do you understand by body surface area? What do you understand by body surface area? These two human beings here now. Which of them has larger body surface area? Is it possible that she may have a larger body surface area than her, and this one has more weight than this one? Yes. Is it possible?
Yes.
Have you seen that body weight is not enough? It's not completely what? Enough. 3 of us, it's not completely what? Enough. So you also check. There's somebody may be like this, Fatibombo, but the weight it may not be that much. Hope you know. There are people that will see the people that are obese. They have body weight. In fact, their body weight is even more than their what? Ideal weight for their age. Am I communicating? Yes. Good. So that's why age is not enough. Body weight is there, but also body surface area. When these 3 are combined, it will give you exactly a better what? Dosing for the what? Child. Now, let me look at this question. This table now is just, this one is simple. We just look at the table already given to us. We just get it from table already given to us. But after this, we'll look into about we look at Young's rule, Clark's rule. Okay, you've done that, right?
No.
So how did you know about that?
We just did it. We did not do any calculation.
Where did it?
In the email last semester.
Okay, AUM. How many rules we are given? Young's rule and what? Clark. Okay. Good. That's good. I like that. So let's look at this question. Example 8.4 says, calculate the oral dose of methotrexate. Calculate the oral dose of methotrexate suitable for a 5-year-old child. Calculate the oral dose of methotrexate suitable for a 5-year-old child who weighs, listen now, who weighs what? 18 kilogram. The oral dose of methotrexate is 15 milligram per m square. M square means body surface what? Area. Weekly. Now, this table, I didn't add this table here. I thought I did though. Try. It's not here. Table of body surface area is not here. Is it there? Huh?
Yeah, online.
Okay, it's there. Okay. Okay, good. I've seen it. It's there. Now, let's use that table to solve this question. Look at what we are given. We are given the child's weight is what? 18 what? kg. And the child is how many years old?
5 years.
The age is what? Age is what? 5 years. Then the oral dose of methotrexate, irrespective of your age, your body surface area is this. What? 15 what? Milligram per what? Meter square what? Weekly. All together. This is the dose of the methotrexate. 15 milligram per meter square. The meter square is body surface area. You can call it BSA. BS what? A. Body surface area. 15 milligram per meter square BSA. Body surface area weekly. That is dose of what? Methotrexate. Now, we are told that the child is 5 years old and the weight is what? 80 kg. Now let's go to that table. Go down to that table. You see the body surface area in children. Look at the body weight. Body weight is what? 18 kg, right? Yes. Now someone should go back to that table and check whether 5-year-old child is actually 80 kilogram body weight. Go back to that first table. Is it actually a 5-year-old? Is it? Yes. Is actually what? 80 kilogram body weight. Now go down to the last table. So it's correct, right? So now let's trace this 18 kg and see what the body surface area will be. 80 kg should have body surface area of what? 0. What? 0.74 what? M what? Squared. This is the body surface area of the child that is 5 years old. Body weight 18 kg and body surface area is what? 0.74. In fact, this is the best way of checking the dose. Am I communicating? Because you put both the age, both the weight, both the in fact, before they calculate this body surface area, they use nomogram. Why I say that this is the best? Before they calculate this body surface area, they use what is called nomogram. They consider the height and the weight of the child. The height, the nomogram has 3 lines, 3 vertical lines. 1, 2, 3. We have the body weight. We have the middle one is the body surface area. The other one is the height. You use ruler to cross. Check the body weight here. Where the body weight is in line with the what? The height. Where it crosses the what? Body surface area will give you the child's what? Body surface area. Have you seen that the weight and height is used? You may see someone that is older, but the age will not be here. So you have to consider all those things. Miracle is sleeping, get up. You have to calculate all these things before you can get the body surface what? Area. That's what they did before they arrived at this what? Body surface area. If you check that 4 table, is there height there? Yes. So before they arrive at this thing, they have done the calculation and before they give us the table. But I will teach you how to do the calculation yourself. This table they see there, they have done the calculations. But I will teach you, we'll learn how to do the calculation by ourselves, how to trace it by ourselves here. So we can also produce our own table if you want to do that. Am I communicating? Yes. Now once you have your nomogram, you can do that. So this is body surface area. Now with this, now we can calculate the dose. Now, what this means is that for me to trace it, 1 meter square body surface area will require how many milligram? 15 milligram of what? Methotrexate. If 1 meter square body surface area will require 15 milligram of methotrexate, the body surface area weekly, the body surface area of the baby is what? 0.74 meters squared. That means the baby will require how many milligram? X. So X is now equal to what? 0.74 meters squared times what? 15 milligram over what? 1 meter squared. Meter squared cancel meter squared. We have 0.74 times 15 is what? 11.1 what? Milligram. So the dose of methotrexate to be given to the baby per week is what? 11.1 what? Milligram. Does it make sense? Any question? Any question? Any question? Ask.
Like in exam period now, if this thing come out, we have to look for the body weight before we can solve this.
Yes, I do. I like my student to read nomogram for me. I'll give you nomogram. You read nomogram. This one they have done, they have prepared it for you and keep. But if you want to, I'll give you a nomogram. You read it yourself. I just ask yourself from it. You read it yourself and do the calculation. So we are going to conclude this lecture by reading what? Nomogram. Now, I don't know if I have answered the question. You can sit down. Huh? There's a table at the end of this place, at this last page. Didn't you print it out? See it here. See it here. The child weight is what? 18 kg. Trace 18 kg here. Trace 18 kg and tell me where it will lead you. The body surface area. Trace 18 kg.
Okay.
See it here. Look what so body surface area. If you get now. Now, so thank God you people we've been taught Young's rule, Clark's rule. It makes it easier for us. Okay, Oya. Hello, Oya. Oh, I'm clean. Have you seen this? Yeah. And I cleaned it. Okay, if you go to the one that you want to understand it, right? Okay, what did Young's rule say? What did Young's rule say? And what did Clark's rule say? Tell me. Okay, I think no problem. In our next class, in our next class, you tell me what Young's rule and Clark's rule. Go back to your notes. You will give me that formula. So maybe, but I want to go to nomogram now. After nomogram, check your if you have data, type nomogram. If you have data, type nomogram and download it. Just type nomogram. I'll choose the one that. Yeah. No, just normal Google. Just Google nomogram. Watch time. At least let's see whether I can do that under 10 minutes. I'll leave you by 3 p.m. Just Google nomogram. Google what? Nomogram. We will use that nomogram to test whether this is correct. We'll trace weight of this child is what? Is what? 8 kg, right? Let's even trace whether this is true. With that, we would have learned how to use nomogram. The weight is what?
18 kg.
Is what? 18 kg. The height is what? We don't know. But trace the height in that material. Those that are not browsing, trace it there. Then the body surface area, they say is what? 0.74 watts. We check whether it's true or not. Then the age is what? 5 watts. Yes. What is the height? from the ideal height is what? 10 what? 9 what? 109 what? Which is how many meters? Divided by 10. Sorry, by what? By what? Is it 100 or by 10? Centimeter, meter. How many centimeter make 1 meter? 100 centimeter make 1 meter now. Centi is 100. Centi is 3 raised to power minus 2. Is 100. So if you divide by 100, you have 1 point what? 0.09 meter. Okay, what do you guess? Have you seen a nomogram? Who has seen a nomogram? Who has seen? Open it. Look, you have seen it now. I need a better. Let me see. See nomogram here. See this one. Let me choose from here. Screenshot it and send it in that our WhatsApp group now. Screenshot it, send it there now. Go to our WhatsApp group. You will receive it now. If you don't want to send it there, screenshot it and send it there now. Then you open it there. Then who has ruler here? Ruler. How many of you have ruler? If you have ruler, bring out your ruler. We are going to read nomogram now. I think that's what we use to end this lecture. Then if we read the nomogram now, we use it to confirm whether this thing is actually true or not. Okay? That table they prepare for us there, whether it's true or not. We use the height of the child and the body weight to calculate the what? But to trace the body surface area to know whether it is actually what? 0.74. Okay? That's what we do now in next 5 minutes. Have you sent it? Good. Open it there. Open it there. Open it there. Is you. Sent. Now, have you seen it? Have you seen it? Good. Now look at this thing. Now look at this nomogram. Start from the left. Go to the right. You see height, right? You see height, right? The height is calibrated in two. We have the cm and inch, right? We have cm and what? Inch. So focus on the one you are giving. You are giving in what? Cm. Hope you know. So we focus on. Is there 109 cm there? There is. Look at the smallest calibration now. Look at the smallest calibration. From 100 to 110. How many divisions are there? 5. If there are 5 divisions from, I want to teach you how to know the value of a division in a scale. Look at from 100 to what? 110. There are 5 divisions, right? And 110 minus 100 is what? 10 cm, right? Right? Then divide that 10 cm by 5. 2 cm. That means a division is what? 2 cm. True of us? True of us? That's the meaning. Now, let's leave the height. Go in between the heights. This one is in the middle for children of normal height and normal weight. This one is for those that have normal height and normal. We don't even know whether this child has normal height. All you know is that they told us the weight. So let's ignore that one. Go to what? SA. Can you see SA here? That is body surface area in meters squared. Now go to the far right. You see weight, right? The weight is is dual. We have pound and what? Kilogram. Can you see it? Our concern is what? Kilogram. Now, have you seen how they cross? This line across is a line that they crossed. If you watch now, it started at a point in height, in the scale of height, and ended at a point in the scale of the weight. Can you see it? There's a place it crossed the SA. That place it crossed the SA is the child's what? Surface area. Now, if you watch, this height now is the height of that person. Where it touches the weight is the weight of that person. So the same way now, we would trace from the height of this child 109 cm and cross it where it touches the weight, which is 18 kilogram, and check where it crosses the what? The SA scale. That will give us the child's what? Body surface what? Area. Does it make sense? Now, what you now do is this. Even though this is not a perfect, the best thing is to print it out. But let's see what we can make do with this, okay? The best is to print it out so you can have a full scale, but no problem. Let's see what you can make out of. We want to test this. We want to check whether this is correct. We will start from 109 cm, end at what? 18 kilogram, and see whether it will cross the SA at what? 0.75. But before you can do this, you need to understand each of the scales. I have explained the scale for what? Height, right? That single, each division is what? 2 what? cm. That means 1 cm. That means 109 cm should be between. If you check from 100 down, it's 10 calibration, 10 division. Can you see it? Yeah. That means that 109 should be a be between 108 and 110. True of us? True of us? Good. Now, let's understand the SA scale. SA started from 0.1, 0.2. What is the, look at, okay, sorry, let's go to weight first. Look at the kilogram side. Kilogram side, look up. The boy's weight is what? 18 kilogram. That means 18, it will fall between 15 and what? 20, right? Now let's understand the scale in that area. Between 15 and 20, we have 5 divisions. True of us? Then subtract 15 from 20. 5 kg, right? Divide that 5 kg by 5. So that means between 5 and 20, 15 and 20, a division is 1 kg. So that means if you want to get 18 kg, just count 3 on top of that 15. You have your what? 18 kg. Is it clear? Is it clear? Why is sighing? If you don't understand, ask questions. Is sighing the right attitude? No, this one is sighing. If you don't understand, ask questions, not sighing. That's a very wrong remark. It's too bad. At this level, you are civilized now. You should put out all those things. Once you don't understand, say, sir, I didn't get what you said here. That's a refined way of doing things, not by sighing. Okay? Good. So what is the issue now? If from here, hello, look up please. If from here, if here is 20 kg, and here is what? 15 kg, and you have division here. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Subtract, if you want to know what this thing means, what you develop this, subtract this from this. You have what? 5 kg. Then you count 1, 2, 3, 4, 5. Divide this 5 kg by 5. Is what? 1 kg. That means one of this line here is 1 kg. Let's check. 15 kg, 16 kg, 17 kg, 18 kg, 19 kg, 20 kg. That's how to read the scales. Is it clear? Now, that means our 18 kg should fall somewhere where? Here. So with this now we will now understand the scale. Let now trace. Get to your ruler. Let's see what you can make out of it. Get to your ruler. I think your ruler is okay. Get to your ruler. If you can come close, you can come close if you want. But if you can do it on your own, wonderful. Just come and see what you are doing here. Here is, what is the child's height? Phone and you know. Just raise your head a bit so that others can see. The child height is what? 109, right?
Yes.
Now, this is Hey, Oga, 1 second, I can again. I was. The child's height is what?
109.
109. Remember, we said that here is a division is how many? This thing? 2. So it should fall between what? 110 and what? 108, right?
Yes.
But the weight is what? The weight is what?
18 kg.
So 18 should be somewhere here. Remember, the kg is this side, not pound now. There are some, if they give the weight in pound, you target here. Now it's what? 18 what? Kg. This is 15, right?
Yes.
So 18 should be here. Here, can you see it?
Yes.
It's 18, right?
Yes.
Then hold it, then move this one up to what? 109. 18 is somewhere here, 109 is somewhere here. Can you see it? Now, check where it crosses this place. Here is 0.7. 0.7 what?
1.
Remember that the one under, this one under here, try to understand this scaling. This is 0.7, 0.8, and there are 5 solutions between 0.7 and 0.8. Remember?
Yes.
Up here?
Yes.
There are 5 there are 5 divisions there, right?
Yes.
Then subtract 0.7 from 0.8. We have what? 0.1, right?
Yes.
Divide 0.1 by 5. By 5.
0.02.
0. What?
02.
So that means a division there is 0.02, right?
Yes.
Now, on top of that 0.77, how many division is there? 2, right?
Yes.
Is it 2?
No, 1, 2, 4.
No, I mean where the ruler crosses.
1.
No, check where is 2. See 0.7 here. See where 18 lies.
Yes.
Is the second distance. If it's here at 9 and this is 18, is at this second division. See it here.
So I see that's 0.8.
3.7.
Let me explain this. Let's understand this scale. Look at this scale now. We have understood this one, right? We have understood this one. Now let's understand this scale. Let's understand this scale. Now this is 0.7.
Yes, sir.
This is 0.8. Subtract 0.7 from 0.8 is what?
0.1.
Then divided by 5. There are five divisions here.
0.02.
0.02.
Yeah.
So now let's know where this ruler. If this ruler touches, what is it?
What in between? What in between?
In between where?
0.7 and 0.2.
In the second line between 0.7 and 0.
Good. That's what I want you to see. Now this one is here. Remember here is between 8 and what? 10. 8 and 108 and 110. And this one is here. 18. It's at if you after 0.7, if you go up, you count 1, 2. Look at it now.
Yes.
2 division, right? So if that means let's find the value of that 2 divisions and add it to 0.7. What will it give us? Let's find the value. What is the value of 1 division there?
0.002.
So what is the value for 2 divisions?
0.04.
Add it, multiply by 2, right? 0.04, right? Add it to 7. Add it to
0.7.
good. Add it to 0.7.
0.074.
No, you cannot.
0.74.
2.7.
No.
So I say 0.74.
What did you get? 0.74.
74.
I want all of us to get the same thing.
0.74.
What are you getting there? Sorry.
Wait. 0.0.
We have agreed that the ruler cross at
0.02.
0. What?
74.
Is that what you all got?
Yes.
Are they correct?
0.0.
They are correct.
Yeah, 0.74.
Plus.
They are correct. What they did is correct.
Plus.
I just want to confirm what they did here. It's correct. So this is how to read what? Nomogram. Are we together? This is how to read what? Nomogram. So if you are given a nomogram and ask you to calculate the best way to calculate body surface area is to use the BSA. That's the best method. Because it will link the weight and what? The height. Young's rule focus on the age alone, which is faulty. Clark's rule use the weight. I'm not complicating, but the BSA method is the best way to do what? To do that. So I want you to look at in our next class on your own. If you can print this out on your own, better. Try to use it to trace on your own and see. You can even confirm all these things they put in that table. If you print it out now, you use a ruler to confirm all those that appendix 5 you saw, where they said that somebody that has a height of this, weight of this, will have a body surface area of this. You can trace it yourself and know whether it's actually what? True or not. We have tried one and confirmed that it's true. Because we got 0.4. You know, this thing will have get issue because it's on phone. If you print it out, you can easily trace it without even stress. Because this is phone, that's why it stressed us. Okay? So I don't know. I said that we'll stop here. And with this now, we are done with dosage calculation. Any other thing we'll just be doing is just calculation. Maybe doing your what, your assessment to just be. There's one question on this BSA in that. Okay, have I sent dosage calculation for you? In the revision question, did I send dosage calculation? Okay, I can do so. No one will still get there. So this is what what is it called? The pediatric dosing is all about. We'll stop here for now. In our next class, we are entering another topic because we are moving with the speed of light. In our next class, we are entering another topic. We are moving with what? Speed of. You're taking your phone, right? We are moving with the speed of. So we can cover before your exam. Okay? All right. Any question? Ask.
So what if somebody made a mistake? Like the person is supposed to measure the right this thing is supposed to be 0.74 and the person does 0.72. Will you feel the person?
the person did not get it now.
Just that small mistake.
Please don't get it. That's the fact. Please, these things are These things are a matter of life and what. You may not understand the implication. Table is. No, now if I give you a question that has to do with the table, I won't even give you anything that has to do with the table. I'll give you nomogram, you trace it yourself. I don't give you anything that has to do with the table. So we are the what? It will be in exam question paper I'll give you. It's not even carry. It will be in exam question I'll give you. No, if there is any need for that, I'll give you what I'll give you this thing now. I don't expect you to carry it in your head. It's not even a good thing to carry it in your head. Do you know why? In practice, it's not good to carry it in your head. Do you know why? You may make mistakes. You may do what? Make what? Mistakes. But having it in your head will help you to have an idea in case you start having issues. You can always remember that should be like this. But if you are in a place where you need to look into the table, please do. Don't say I know it. Is it clear? But for the purpose of the exam, if there's need for me to set a question like that, I'll give you what to use. All right. In absence of any question, we'll stop here for today. Thank you very much. God bless you.